years since Bob Reischauer and I put this idea forward, I've changed my mind. And I would like to just list a few of the reasons why I've changed my mind, and I think I would urge you to consider them as well. The whole environment of healthcare policy has been transformed. We wrote in the wake of the failure of the Clinton health reform effort, and at a time when projections of the insolvency of the Medicare Trust Fund were becoming steadily worse and were very near term. Both of those elements has changed. And in particular, the passage of the Affordable Care Act means that we have put in place a key element of the premium support idea for the rest of the population, namely health insurance exchanges. We're finding those are difficult to implement. They're politically controversial. I think they will succeed, and those problems are solvable. The Medicare population is vastly more difficult to deal with than the population served under the Affordable Care Act. We should prove that the health insurance exchanges work, get them up and running before we take seriously, in my view, calls to put the Medicare population through a similar system. The regulatory climate has changed. It is far more hostile to the kinds of regulatory interventions, pretty aggressive regulatory interventions, that Bob Reischauer and I thought were essential to the functioning of a premium support plan. We at the time said that no premium support plan should move forward until risk adjustment was good enough to discourage competition based on risk selection. At the time, like Alice, we thought, oh, well, it's doable, sometime it will happen. Alas, it hasn't happened yet. A recent study has shown that the risk adjustment algorithm used under Medicare Advantage actually has increased the degree of risk selection that occurs through Medicare Advantage. We're not there yet. When we are, that would be the time to consider whether premium support merits consideration. And finally, the idea that competition is going to save money. As an economist, I really want to believe that. I got my degrees in that, and I was pledged to like markets. I really do. The evidence to date is not encouraging. The higher costs of Medicare Advantage are not attributable to the solely to the extra costs, extra payments that are made to them, nor is it attributable to selection of patients. After controlling for all of those factors, Medicare Advantage plans are more expensive than is traditional Medicare.